Firmly standing as the cultural vanguard of West Java, Indonesia, nourishing the intellectual life of the nation, working for the benefit of the global world. This is Universitas Padjadjaran. Inspired by the vision of the Asia-Africa Conference, attended by representatives of 24 countries, the establishment of the university was the realization of the vision of the cultural figures of West Java to found an institution of higher learning in the cosmopolitan city, to educate and set forth to society dedicated and qualified individuals. Today, UNPAD has broadened its wings to encompass various disciplines and multidisciplinary academic endeavors through the efforts of 16 faculties and 1 postgraduate school. To achieve its mission to build the capacity to adapt and innovate in the face of the rapid development of science and technology at the international level, UNPAD is determined to become the center of research and innovation for the good of the nation and the world by continuously nourishing research and developing technology to create innovations in various disciplines. Currently, 36,000 students are registered at UNPAD, and more than 200 international students are registered in different programs, degree and non-degree. As an effort to constantly improve the quality of education, Universitas Padjadjaran is supported by approximately 2,100 professional faculty members with reputable qualifications. To achieve the goals of its mission, UNPAD has also established notable research centers which demonstrate serious commitment to and focus on achievements in a number of strategic fields such as the Center for Sustainable Development Goal Studies, the Center for Environmental and Sustainability Sciences, the Academic Health System, the Center for the Digitalization and Development of Sundanese Culture, the Center for Innovation and Pharmaceutical Services, the Center for Nanotechnology and Graphene Research, to name a few. Equipped with a central science laboratory network and a science and technology complex in the Center for the Development of Science and Technology on the main campus, Universitas Padjadjaran has risen in its role as a leader in higher learning geared towards innovation. UNPAD also fosters collaboration with other institutions involving all stakeholders.
Universitas Padjadjaran commits in providing benefit and service for the good of humanity and the preservation of the environment. This is a great enterprise which cannot be done alone. UNPAD believes that in the spirit of collaboration, this vision may be achieved. We invite you who have the same vision, a good intention to care for human life and the environment all over the world, to work with us, build collaborations, create a better world together.
Universitas Padjadjaran grew out of the community and has made it its duty to give back not only in the form of the dissemination of knowledge and information, but also through socially responsible activities such as student fieldwork, community outreach programs, and action research seeking to make direct impact on the community. With its feet firmly grounded in the local communities and environment, UNPAD is also making great efforts to take steps towards internationalization. It offers special programs for international students to maintain its global network and make its strategic and reputable place on the world map of higher education. As a site for the personal development of young minds and bodies, UNPAD supports a wide variety of student activities. UNPAD also provides students with libraries with an extensive collection of books, periodicals, and study materials, comfortable dormitories, health and fitness services, free on-campus transportation, and other supporting facilities which UNPAD continuously upgrades and improves. While being committed internationally recognized quality research, UNPAD maintains also its dedication in preserving traditional cultures as the compass for all of UNPAD's activities on and off campus. As of now, UNPAD have set forth unto society 200,000 graduates in various fields of work, including strategic government sectors and crucial multinational industries. Works for the good of society, bringing innovations and sincere contributions to humanity. Universitas Pajajaran, the pride of West Java, working for the benefit of the global world.
Are you interested in learning about Cleft and Palate with experts from around the world? And you can learn this for free while gaining 3 credits. Come join our online course in collaboration with Faculty of Dentistry Universitas Pajajaran and Smart Train.
Okay, thank you, Professor Titus, for attending today's live session. Welcome in this massive open online course in Cleft and Palate. On behalf of Faculty of Dentistry Universitas Pajajaran, we would like to thank you for collaborating, sharing your knowledge with us today. So, Professor, your lecture has been embed or has been shared to our students, to our participants in massive open online course platform, and they already watch your lecture, and they already sent us some of the questions, Professor. Before we start, I would like to introduce myself. My name is Erli. I am the lecturer at the Faculty of Dentistry Universitas Pajajaran, and we have here the student organizing committee attendance with us today, and also the participants of the online course from not only from Indonesia but also from other countries, Malaysia, India, and other countries too. So perhaps Panitia, can you share the screen with us? Contains the question for Professor. Yeah.
Okay.
Okay, the first question, Professor. Next slide.
Yeah. I'm with you.
Yeah. Why does fusion takes longer in females?
Well, in developmental anatomy, it's not only in fusion on cleft lip and palate. It has also been found that generally development takes a little longer in females than in males. However, you also know that when we're talking about congenital anomalies and pregnancy losses, the male somehow is even more vulnerable than the female. So these are some of the questions that science has been trying to unravel from genetics. So even though it takes a little longer in overall in females than in males, still the male fetuses are usually even more vulnerable. And even at the early stages of life, the male is also more vulnerable to both the genetic and environmental factors that can affect development. But it's been documented that the fusion takes a little longer in females than in males. So it's just a genetic predisposition.
Okay, Professor. So next question, please. So we have a question from Mutiara, Universitas Pajajaran Indonesia. What is the best way to do to prevent those developmental anomalies from happening?
Well, what we teach here for all women is, since we know that folic acid deficiency is one of the contributory factors to congenital anomalies, generally, not only cleft lip and palate, even hydrocephalus and other congenital anomalies. We advise that women in childbearing ages, especially in developing countries where nutritional deficiencies usually found to be common, should start taking folic acid even before they get pregnant, or in the early stages of pregnancy. They must have to register for antenatal very early in life. And those who have cleft lip running in their families, for instance, some families you may have a mother that had it, or you may have a sibling that had it. The chances of the next person in that family getting it is high. So we start early screening, and also they take precautionary measures. Again, those who are epileptic and are taking drugs to control epilepsy should also know that they interfere with folate metabolism and can also be a predisposing factor to development of cleft lip and palate. So they also should start taking folic acid early and screen early to determine whether we have these problems. Rest is not really of much importance to this. The person should go about normal business as much as his energy or her energy can carry her. But the best way to prevent is to anticipate, knowing that it's a combination of environmental and genetic factors. So those who have genetic predisposition, screen early, take precautions early, then avoid taking some drugs. You also know that in our environment, at the early stages of pregnancy, they have some problems, nausea, vomiting, and all that. So they take drugs thinking that they are just sick. Some of these drugs also interfere with the early stages of development. And at these early stages of development, just a little insult can affect a whole wide range of structures. So the best to do is a woman in the age-bearing bracket should take care of all this.
Yes, thank you, Professor. Because I read from your lecture, the facial development starts from 4th week until the 10th week intrauterine, right, Professor? So at that stage, the woman, the pregnant woman, perhaps does not realize that she's pregnant at the time. So it's
yes, may not even know that she's pregnant. And taking all forms of drugs to control these early symptoms of pregnancy, which can then affect the developing embryo.
That's right, Professor. So the key components here are pregnancy planning, I think, yeah. Pregnancy planning, and then take folic acid before even the planning. Yes, that's right. Thank you, Professor. So we... Yeah. Next questions, perhaps? Next slide, please. Okay, is there any intervention available to lessen the risk of developmental anatomy significantly after finding out that the cleft is occurring? From Faras, Universitas Pajajaran.
Well, the interventions, genetic studies are now ongoing, and some findings have been made. Those who are predisposed are screened early, and when it is discovered that they have that they are likely going to have a child with cleft lip or cleft palate, then the planning on what to do starts early. We also know that with the high resolution ultrasound now, the diagnosis can also be made intrauterine, and the patient is counseled early so that they prepare for it. Once the woman and the family are prepared that this may occur, they are usually in a better position to accept it. And if the problems are those that may not be compatible with life, then they are counseled. Genetic counseling has come to play in these developmental anomalies now, that with early screening and decisions can be taken early. Again, with improvement in surgical procedures, now we are beginning to think about carrying out surgeries early. However, under the SMILE train, surgeries carried out around the world has shown that most of those ones done very early have greater chances of mortality and morbidity. So that's why currently it is pegged at 4 months thereabouts, and a minimum weight of 6 kilograms. But for those ones that are quite debilitating, we can start early intervention where the expertise is available. Now, with microsurgical procedures, with better anesthesia, surgeries can be carried out. Even some attempts are now being made to do some intrauterine surgeries for babies with significant congenital anomalies. So the intervention is now available to lessen the risk and the burden. So you know that early for cleft lip is actually the parents, their worries that is more important. But with palate, it also affects the feeding, and that also affects the overall development of the child. So there's a lot of intervention are going on now to help parents and the patients.
Okay, thank you, Professor, for the excellent explanation. Well, actually, here our participant has question for you. Perhaps the committee can put it on the slide so Professor can read it.
Okay.
Mm-hmm.
So I can't see the slides.
Yes, Professor, please wait. Come on, committee.
Okay.
So let me just, okay. If both parents have CLP, yeah, does their future children will have higher chances to have CLP too?
Yes, they have the higher chances of having children with cleft lip and palate. Is there any way to prevent it? First is what we discussed initially. Will be started early. Issue of avoiding certain drugs, starting folic acid early, taking a lot of multivitamins, and then screening early, intrauterine screening to find out. Then genetic counseling. In fact, recently some genetic counselors can look at the parents, tell them the risks, and they decide whether they want to have children or not. And if they want to have, they now prepare their mind that they may have some challenges. But the good thing is that since they all survived to get to adulthood and get married and have children, that also means that they are more prepared to help the children. Again, the issue of cleft lip and palate is a major one, which the parents who have lost one or two are more prepared to handle another. In fact, I have some families that I have handled about 3 and some 2 of their children. But once you treat the first person, the good thing is that by the time they have another baby with a cleft lip and palate, they are more prepared psychologically to handle the issues. So when both parents have cleft lip and palate, their future children have higher chances. There are percentages of these chances, but that's not part of this lecture. But we have them. In fact, once both of them have it, they have more than 9% chances of having their future children with cleft lip and palate too. We have familial cleft lip and palate. I've documented quite a number of such families where the grandfather, the father, the mother, the child had cleft lip and palate.
Okay, Professor. So we have still one more question from the participants, but while the committee prepare for it, I have one question, Professor. Okay. So it's about the cleft is more frequent in upper lip. In your lecture, you mentioned the maxillary prominences fuse together to form the upper lip. Why is it more frequent that cleft occurring in upper lip rather than in lower lip in the fusion of the mandibular prominences? Why is it more frequently in upper lip?
Well, somehow you know that the upper lip, the structures that come in from the frontonasal process and the bilateral maxillary processes coming in is a little more complex than the lower lip, where you just have the mandibular processes coming in to just fuse in the midline. But here you have the frontonasal coming from up to meet with the two bilateral maxillary processes coming in. So that increases the chances of clefting, inability to fuse, or poor mesodermal infiltration to strengthen the fused structures and breakdown.
Okay, Professor, I understand. So, committee, we have a few more questions from the participant. Can you share it in our screen, please? Okay. Is it recommendable for a child to undergo surgery when they are already reached school age? From Iman, Management and Science University, Malaysia.
Yes, at any stage. In fact, I have had to repair clefts in even adults. At any time it is discovered, you can still undergo surgery. The truth is that if it's only cleft lip, the psychological problem is usually very, very high. In fact, many of them don't even go to school. Some go to school, they perform poorly because they are bullied by their mates. So at any stage in life, the surgery can be performed. Then for cleft palate, yes. When we do it at this stage, we follow up with speech therapy. We counsel them and get them onto the speech therapy program, which helps them to improve their speech a lot. And one thing is that they are usually very, very happy. Usually very, very happy when they get the surgery done. In fact, I had a patient here who finished high school and was already in the university. But when the surgery was done, she was so happy. She had the lip done as a child. The palate couldn't be done. The parents couldn't afford the money. But luckily for her, Smile Train has come in when I met her, and the surgery was done. The palate repair was done under the Smile Train free cleft program. And she remained grateful up till today. In fact, she will usually call me every year to say, doctor, just to thank you, just to know how you are doing, just to say thank you again. So surgery can be done at any age, whether for lip or palate. And their life will usually improve greatly once the surgery is done, even for the palate. It's a transformational surgery, more or less.
Okay, Professor, thank you. Very much. Next question. Committee, please. It's about folic acid, Professor. Is folic acid level test should be done as routine examination for every married woman or just by recommendation?
Okay, is folic acid level test be as a routine examination for every married woman who is planning to have children? Well, I would say yes, where it is available. In most developed countries, these tests are not easily available. And that's why the World Health Organization for at least developing countries and the middle income countries now recommended that since overall studies have shown that a greater percentage have some degree of deficiency, that they start taking folic acid as early as possible in pregnancy. But where the tests are available, why not? It should be done. And once a woman is found to be deficient, then they can start. And if it's a Cleft family, yes, you must anticipate that, because a lot of factors also go into that folic acid, both the metabolism, both the receptors, both the personal genetic disposition of the patient can also affect the uptake. So not just that you've taken it, it may not even get to where it will function. So, but for a family that has a Cleft, that risk, then it is even more recommended that they start folic acid early. And the situation, what do you recommend is that by the time one is missing her first menstrual period, the development has already started. I hope if you remember from even our biology, you find out the woman must have taken in. It is by the next 2 weeks when she will expect her menses that she will now know that she's already pregnant. And because one will usually want to wait to know whether it's coming or is it delayed, you find out it will take almost a month before she even begins to suspect that probably I may be pregnant. So that means that the damage must have started early. That's why it is recommended that the women in childbearing ages who want to take in should start taking folic acid as early as possible, so that even before they get pregnant, they already have an adequate level of folic acid in their system.
That's right, Professor. Thank you very much. We have more questions here, Professor. You have lots of fans, I think, here. Committee, are you ready, or should I just read it? Okay.
We're still processing.
Okay.
Okay, maybe in just a moment.
Okay.
Yeah. We have here a question from Asha. Does the anatomical defect in cleft lip or cleft palate can cause mortality in child? In what age is common, and what the causative factor?
Yes, it's significant mortality in cleft palate. For cleft lip, chances of mortality is very low if it is isolated cleft lip, whether it's bilateral or unilateral. It does not affect the feeding. However, it affects the psychological impact on the parents, usually so high that sometimes it is the parents' fact that starve the children to death. And there are several myths, depending in the culture, that affect these children, because the parents first will feel defeated, feel sad, a lot of family problems. So the childs are usually neglected, hidden away from the public. The mother usually unwilling to even breastfeed the child. Now, when they have cleft palate also, the mortality increases tenfold. First is that the child, usually they are not able to suck breast milk, which is usually a first food that sustains them. And they also have higher chances of having upper respiratory tract infection, pneumonia, recurrent middle ear infection. So all these affect the child, and the development is usually also delayed. So most times the mortality is very high when you have a cleft palate. Even when they have isolated cleft palate, the mortality is also much, much higher than in isolated cleft lip. So once the palate is involved, mortality is very high. And within the first 3 months, many of them are dead. But once they survive the first month of life, chances of survival is higher. So that's why once the child is delivered, we start the counseling, we start telling the mother, showing the mother how to breastfeed, how to express breast milk, and feed them, encourage them until the child grows up. So the chances of death in a child with cleft
Professor, can you hear me?
Sure.
I think we lost Professor due to signal. Hello, Professor? Hello?
Yes, I'm with you. Yeah, hello,
Oh,
I'm with you.
yeah, yeah.
I'm with you.
We
No,
lost you just for a few seconds.
okay.
Okay. So we have questions. Committee, please turn off the screen. We have question from Faculty of Dentistry, Universitas Pajajaran. Professor Ani, can you open the camera, please? You can ask your question to Professor Titus directly. Prof. Ani? Yeah. Okay.
Hello, Titus.
Yeah, thank you.
I'm Annie of Faculty of Dentistry Unpad. I have a question about what do you think about the zinc deficiency in the pregnant woman as a environmental factor for CP? Zinc deficiency, Professor?
Announcing about also supplementing. That is why one of the methods of preventing congenital anomalies now is trying to improve the diet, especially of young women of childbearing age all over the world. The WHO is already working on that, so that all these nutrient deficiencies will be tackled as a way of
Hello, Professor. We lost you. Hello?
Sinyal.
Hello, Professor.
Hello.
We lost you for a few seconds.
Hello, did you get my answer?
No, please perhaps rewind for the next the few back seconds, 10 seconds perhaps.
No, I said that zinc deficiency is now becoming very important. In addition to other nutrient deficiencies in congenital anomalies, including cleft lip and palate. And already recommendations are on now about improving nutrient management in young women, especially those of childbearing ages, because studies have shown that these nutrient deficiencies contribute significantly to development of congenital anomalies, including cleft lip and palate, hydrocephalus, and others.
Yes, because in Indonesia there is the region in the west region. West Timur West.
Yeah.
The west region there is a higher prevalence of CPL, and then the environment is in the water is lack of zinc.
Yes, because like I said, environmental factors also play a role, and sometimes the environmental factors contribute to the nutrient deficiencies that we are seeing. So we are seeing a whole complex of
CPL
factors involved in that development. So it's being tackled from different ends to reduce the incident.
Okay.
Okay, thank you, Prof, question, Prof. Ani? Yeah. So, Professor, I think that's all the questions from the participants today. I would like to remind to all the participants here, we have young women here in childbearing age, Professor. So, after seeing your lecture, we have to understand that the importance of family planning, pregnancy planning, because the developmental of the phase already start on the 4th week, yes, Professor, and finish at the 10th week of the pregnancy. That's right. So the women should plan early and then note their nutritional intake, right, Professor?
Yes, it's important at this stage.
Mm-hmm. Yes. Any more questions from the participants? Please feel free to raise hand and open your camera if you have more questions. If you don't have more questions, then perhaps, Professor, that's all our live discussion session for today. On behalf of Faculty of Dentistry, I would like to extend our gratitude. Professor, maybe next time we can extend our collaboration to the next stage between Nigeria and Indonesia, Professor. Thank you for your time, for sharing your knowledge.
Yeah.
See you again next time, Professor. Goodbye.
Thank
Thank
you.
you,
Bye.
participants. See you later. Bye.
Titus.
Bye. Thank you, everyone.
Stop recording, please.